Okay, so it says I am recording. So good afternoon. This is Shirley Banks, also known as Food Girl 29, just coming to you with another video. And I just did this with one of my colleagues on Instagram, and just wanted to do like a little quick short video, give you the cliff notes of what we talk about. And basically this kind of video started because we were talking about issues that we have in terms of heartburn, indigestion, GERDs, those kinds of things. But it came about as a study she read on which women and waist trainers and how that impacts your gut health overall. So we won't get into the study too much, but we are going to get into some nuggets on heartburn and indigestion, okay? So let's look at this, okay? So we're going to have a conversation around that. This is something that affects millions and millions of people. So if you're suffering, you're not by yourself. So are you having issues with heartburn, reflux, GERDs, burning sensation in your chest, especially that increases at night after you're eating, difficulty swallowing, sour taste in your mouth, food regurgitation, belching, are you gassy, are you vomiting? I've even, as a nurse, my background is in healthcare. We've had people come into the hospital complaining of chest pain, thinking they're having a heart attack, when indeed what they've been doing is been diagnosed with GERDs, or gastroesophageal reflux disease, okay? So that is the diagnosis. So we're gonna talk about that a little bit today, okay? And so a lot of times people just, well, I'm just gonna avoid these foods, like whatever it is, like if it's coffee or ribs or orange juice or pizza, whatever it is that increases your symptoms, sometimes you just avoid the food and think, that's good enough. Well, it does help, of course, because you're not feeling as bad. You want to ask yourself, is what I'm feeling, is it chronic, or is it just like something I just had like 1 or 2 times and it's not really a problem? But if this is something that's going on all the time, then you definitely want to make sure that you have been checked out. And we're going to get into that later, okay? Let's talk about, why do you have GERDs? Why do you have heartburns? Why do you have reflux? And Ray talked a little bit in our talk on Instagram about waist trainers and women who wear waist trainers to, lower the girth of their waistline. And sometimes that displaces the organs within the abdominal cavity, increases inter-abdominal pressure, and actually causes that sphincter to open up, and then you get that reflux. And that's just not really overall good and healthy. In the studies that she referenced, most people didn't notice an issue overall until, a couple months after time, because, and I'm not sure because I don't have the study in front of me, but is waist trainers good? Is it contributing to your gastroesophageal reflux? Is it contributing to your heartburn? That might be one of the questions you want to answer. And it could be, especially if you're obese and you're dealing with other things that we're going to be talking about, okay? So is it the waist trainers? Is it your age? Is it diet? Is it lifestyle? Is it obesity? Is it too much acid or too little acid? What's really going on? Why am I having GERDs? Why am I having heartburn? What's really going on? Let's talk about it. Come on. I'm gonna give you some information, okay? All right, and just a disclaimer as I go into this, I am not your doctor. I don't take care of you in any kind of way. This video is for informational purposes only, educate you about some things that I've experienced and understood as it relates to gastroesophageal reflux. You want to talk to your doctor, or whoever your person is, your nurse practitioner, your PA, physician assistant, functional doctor, whoever is taking care of you, and get your advice from them. But this is just to have some conversation around that and maybe give you some things to think about if you didn't have that information already, okay? That's my disclaimer. So let's look at some of the issues, right? So is it too much acid or is it too little acid? Is it obesity? Is it your age? Is it your diet? Is it your lifestyle? So we're gonna look at these issues, and we want you to stop medicating the symptoms, because if you're taking medications, the limit the acid to kind of neutralize it a little bit, you may just be putting a Band-Aid on it. it may just be a temporary thing if you have not determined what is the root cause of why you're actually having the heartburn, why you're actually having the GERS issue. Okay, so we want to help you to identify the issue. Okay, so most medications, as I said, whatever you're doing, they're going to offer a Band-Aid. It's going to be temporary, and you know, they help. You feel better. You know, it does suppress the stomach acid. You feel better, right? So I'm not discounting that. So, but first of all, first things first, acid is supposed to stay in your stomach. It's not supposed to be outside of your stomach. We're supposed to chew our food, right? We need to swallow our food. The food goes down the esophagus, and then this little sphincter opens up for the food to enter the stomach. And I have this little, I don't know if you can see it here, but basically, this is where we ingest right here, our food, we chew it. And your mothers always tell you, make sure you chew your food well. That's where digestion begins, right there, thinking about your food, looking at your food, chewing your food well, okay? And then you swallow, it goes down your esophagus right here. This is all tissue that's can be very damaged by that constant of acid coming back up. And then it's supposed to be released down here into your stomach. But what causes that to not happen or to open up and happen is a sphincter right here. It's called the lower esophageal sphincter, okay? So that sphincter is supposed to open and let food come into your stomach. And then after the food comes in, it's supposed to close. And it only should be opening if you're belching or if you're letting food in. Otherwise, that should be closed. So why is the sphincter opening up? Why is it allowing contents for the stomach to come back up into the esophagus? Remember, we said the contents of the stomach is supposed to stay in the stomach, okay? The acid in your stomach is the contents of your stomach. The acid is kind of, I've heard it described as battery acid. So it has a very, very low pH. It can burn you, okay? So that's why it's supposed to stay in the stomach. So when it goes back up into the esophagus, what can happen is you can cause damage to those delicate cells in the esophagus. You can cause scarring in there. You can cause constriction where it gets smaller. The opening is not as big as it needs to be. It gets smaller. It can cause ulcerations in there. And it can even over time, if it's not addressed well, it can cause cancer, okay? So we want you to know these things. We want you to be aware so you can take care of yourself. First thing, chew your food. Second thing, stomach acid is supposed to stay in your stomach. It's not supposed to go back up into your esophagus, okay? So is it your age? Is that one of the things that you're dealing with that's causing this to happen? So as you get older, this muscle, we talked about that lower esophageal sphincter, it becomes weaker. And not only that, with age, you have decreased stomach acid. So that's a bang, number one. Number two things. By the age of 40, you like half of your stomach acid you don't have it. And then by the time you get 80, you have almost no stomach acid as well. And so there was a study that I read where they looked at, this is in the Journal of American Geriatric Society. Geriatrics deals with older people, older population people. And basically what it says is that over 30% of people over age 60 experience little to no stomach acid secretions. And another study found that 40% of postmenopausal women produce no basal gastric acid. Yet GERS is the most common in these populations. So why are millions of people taking acid suppressing medication to treat this disease? Okay, so these are studies saying that there's not even acid there. So why are we doing this? What is really causing this? Is it too much acid or is it not enough acid? That's the question we're trying to answer today. Okay, so age, that muscle is weaker, you have less digestive enzymes to help you out with digesting your food, okay? Is it obesity? Are you overweight? That increased belly fat increases your intra-abdominal pressure. And that can cause pH changes within there. And when you get that, that lower sphincter doesn't open up to release the go into the small intestine. So the lower esophageal sphincter opens back up and you get that regurg back up into your esophagus, which we don't want, right? And then if you're wearing a waist trainer on top of that, you've got a high BMI, you're obese, you got a lot of belly fat, and then you're wearing a waist trainer, it can make your gastroesophageal reflux disease worse, or your heartburn worse, or your reflux worse, okay? Is it your lifestyle? Is it alcohol? Is it smoking? Is it stress, okay? And we know that stress is a huge issue. This is 2020, and it has been some stress related to this year. And so I'm not discounting that, but I hope you're managing your stress as well as possible. So, but these things can actually increase these symptoms of reflux disease and heartburn, okay? And the combination of cigarettes and alcohol makes it even worse. Now, cigarettes, what it does, that smoking, it actually damages the mucous membranes, okay? So you got damage to the mucous membranes. It also increases stomach acid and lowers the function of the lower esophageal sphincter. It decreases that ability for it to function right. So those things are not a good combination. So we're talking about, why is that sphincter opening up to let this acid back into my esophagus? Is it, we talked about age might be a factor, obesity might be a factor, lifestyle might be a factor. So we can't do much about age, right? Because you are your age, that's it. But can we do anything about obesity? Yes, we can. And we'll talk about that a little bit more. Lifestyle, can we do anything about lifestyle? Manage our stress, alcohol and cigarette smoking. We can do something about that. You might need some help to get some help done, but help is out there. But I want to tell you, though, these are 2 things that you can do, that you can put into practice to help. Maybe the other reason why it's regurg is maybe you're pregnant, and that's a very common thing. So if you're pregnant, you're going to have increase in hormone levels, and you've got a growing baby inside you, right? So it's pressing up against other organs. And so you might have, this is more common when you're 2nd or 3rd trimester, but usually what happens is, once you deliver that healthy baby girl, baby boy, or twins, or whatever you're carrying, that goes away and that's resolved. It's no longer an issue. Or maybe you've got some stomach abnormalities. We're talking about things that may, help the increase of reflux back into your esophagus, because that sphincter is opening up and allow it in. And is it because of these things? Age, obesity, lifestyle, pregnancy. Maybe you have some stomach abnormalities. Maybe you've got a hernia, hiatal hernia, which can happen at any age, right? It can happen from an injury. It can happen from birth, pregnancy. Even if you're lifting too much, if you're straining too hard to have a bowel movement, you can have a hernia, okay? So we want to figure out what's going on there. We talk about digestive enzymes. As you age, you don't have as many digestive enzymes as you need. And so, because our body makes digestive enzymes. That's the way it was created. Our creator created that way. So we get them from food, but our body is designed to make them. Our saliva, our pancreas, our liver, our gallbladder helps to break down food. So you have protease that breaks down protein, lipase that breaks down fats. You have amylase that breaks down starches and carbohydrates. You have lactase, which comes from your birth border in the small intestines to help you break down milk sugars, and also sucrose to break down sugars in there. So why are these low? Why are digestive enzymes low? If that's something our body is supposed to have, why are they low? It could be your age. Remember, we talked about as you age, you get decreased enzymes. It could be stress. It could be lactose intolerance, okay? It could be you have a disease, that maybe you have leaky gut, maybe you have Crohn's, maybe those things. But how would I know, Shirley? How would I even know if my digestive enzymes are low? You have gas? Are you bloated? Are you bloated? You have indigestion? Maybe your hair and your skin is dull, maybe you have undigested food in your tummy. You can have diarrhea and constipation all at the same time, right? Maybe you're having food intolerance. Maybe that's something that's going on. So digestive enzymes, what they do is they reduce these symptoms, and they also increase your ability to get the nutrients from the foods you're eating, okay? And they also have an inflammatory effect. So sometimes when you're eating foods that are not good for you, other things, it can cause inflammation in the gut. And these digestive enzymes can actually help to calm down that inflammation. As well as if you take them away from food, it can actually help to disrupt that biofilm that can accumulate. And that biofilm, what it does sometimes, you have bacteria and stuff that get in there like H. pylori, and we'll talk about that in a minute, that can kind of hide under that biofilm. And when it hides up under there, these enzymes can actually go in there and break that biofilm up so that the body can move it on out as you're treating it, okay? So let's talk about low stomach acid, because remember, you're saying you got too much stomach acid. I've got a question for you. Are you sure you have too much stomach acid, or is there not enough stomach acid? That's the question. So too low stomach acid increases reflux because of pH level changes within your gut. It also, like, you don't have good digestion. And because of that, you have bacteria overgrowth. You know, food, it's upset your stomach. Your food stay in your stomach too long. Then you have gas. Your pH levels are too low to open that sphincter to go into the small intestine. So remember, we said we had two sphincters. We have two openings here. This food this one lets it into the stomach, and then digestion happens. Then it should open up and go into the small intestines with this sphincter here. It should open up. But if those pH levels are not right, that sphincter is not going to get the message that I need to open up and let this food in. So you've got all this food sitting in your stomach. You're feeling like, oh, I'm not digesting my food well. You've got all this intra-abdominal pressure going on. You burp, you get a little regurg back up into the esophagus because that lower sphincter is not opening. You don't have enough stomach acid. You don't have enough. So stomach acid is designed to kill bacteria and pathogens. So you getting this stuff going on in your stomach is because you don't have enough stomach acid to kill the bacteria and stuff that you're ingesting. So things like SIBO, which is small intestinal bacteria overgrowth, H. pylori, which can cause inflammation into the stomach lining, and if you ever had gastritis, these are things that's going on in here. You can also have irritable bowel syndrome, ulcerative colitis. You can have Crohn's. All of these things are maybe a manifestation or side effect that can possibly be from not enough stomach acid in the beginning, okay? So your cells, the parietal cells are actually supposed to stimulate this acid and stimulate pancreatic enzymes. But if you don't have it there, it may be, you're not going to be able to, digest carbs as well as you should be able to. And so then you have that small intestinal bacteria overgrowth growing. You get that increased abdominal pressure there. You don't have the nutrients absorbed like you need to, so you might be missing iron and B12, zinc, and folic acid. All of those things is because you don't have nutrient absorption, okay? So how do we fix this? Maybe we can't fix it, but we can make some tweaks to whatever we're going to do so that we can have it better. The goal is to, try and find the root cause so we can figure out this is what's causing it so I can prevent that, right? So is it diet? Is it lifestyle? Is it botanicals that we need to add? Is it nutraceuticals? Remember we said we're not getting the nutrients that we need in. Is it pharmaceuticals? Is it that we need to address the microbiome overall? Is the gut bacteria within the gut, where all of that lives? Maybe we need to address that. So maybe you have a combination of the things. Maybe you've got the obesity, you've got the age thing going on, you wearing the waist trainer, you've got the lifestyle issues with smoking and alcohol, maybe you got a hernia too, you got all of this stuff going on, and you've gone to the doctor and they've given you some medications. Normally they're going to give you a PPI, which is a proton pump inhibitor, or H2 blocker, right? You feel better, right? Because the meds did what you needed to do. You're not getting that burning sensation, you feel better. So you're like, what is the issue? Well, let's talk about that a little bit. Everybody knows about the little purple pill. And another disclaimer here, I'm not against any medication. I'm not telling you, I'm just giving you some information that I, in putting this together, that I read in some of my experience, okay? So what is a PPI and H2 blocker? They're designed to for you not to feel all the effects of having too much stomach acid. But remember we said there may not be enough stomach acid. That may be the real issue. You have to figure that out, okay? Long-term and high doses of these things are associated with decreased magnesium level, increased fractures, increased risk of defections like C. diff, SIBO, peritonitis, liver issues, and kidney issues. And that's what we said, long-term high doses. So how long have you been on your PPI? Or how long have you been on your H2 blocker? Or how long have you been going to the pharmacy and picking up some over-the-counter medications? So I'll just name a few of the PPIs, and I'm not bashing any of them. I'm just naming something you might be familiar with. This is just a disclaimer. These are things that are prescribed for this condition. So you might have been prescribed Nexium or Prilosec or Prevacid. What they do is they decrease the stomach acid amounts, and there's a stronger medication, so you feel better right away. So they do their job in doing that, making you feel better, right? Maybe you have a H2 blocker, maybe like Zantac or Pepcid or Tagamet or Axid. They reduce the amount of stomach acid produced, especially in the evening time when sometimes it's a little bit more problematic when you're getting ready to lay down and you've got this stuff preventing you from sleeping because you've got this regurg going on. So maybe that's what they're doing. But how long have you been taking them? From the information, some of the information I read, now you also want to discuss this with your doctor. I am not your healthcare professional, okay? It says Prilosec over the counter should be taken 14 days, 3 times a year. So the max is 14 days, so 2 weeks, up to 3 times a year. Nexium, Percocet, 8 weeks. That's like 2 months. Have you been on it longer than 2 months? Pepcid, Zantac, 14 days. So that's like 2 weeks, okay? So you need to read the fine print, read the label instructions to see how long. Maybe you're not on high doses, maybe you're on small doses, you're not having problems with it. But remember we talked about long-term high doses, the damage it can actually do to the body. Maybe you've been on this prescribed Prokinetic, which is a medication that helps to strengthen. Remember we talked about that sphincter that's opening up to let the contents flow back up into the esophagus. Maybe you've been on one of those, and a Prokinetic, and they strengthen that lower esophageal sphincter, and it helps the stomach contents to empty faster. So you don't get this buildup of intra-abdominal pressure. You don't get this buildup of potential for having impaired bowel emptying, or developing some kind of infection in your gut for SIBO or anything like that. Usually these are prescribed for people with severe GERS, and maybe people who have diabetes or who have some kind of impaired bowel emptying diagnosis. So you may not have had those yet, but common medications that I have given, as I said, I am a nurse. Reglan is one of the medication. There's a common name. And basically what it does is it improves the action of that muscle, right? But it can have side effects called tardive dyskinesia, which is like this excessive movement, uncontrolled. And if you ever seen a person with tardive dyskinesia, you don't want to have that. Also, Propulsid is a medication that I've given in the past. It was taken off the market. It also improves this muscle tone, and because it was causing people to have some issues with their heart rhythm, okay? So there's also a medication that's kind of like an alginate or alginate-based therapy. And basically what this does is kind of creates a barrier between the stomach acid and the esophagus. So it's kind of like a polymer from seaweed. And this is for people who have like mild intermittent reflux, like maybe you're pregnant or maybe for a baby. This is not something that's normally given, and that may be Gavasson. That may be the medication. So what do? So if you have these issues, and so you may have already been being seen by your doctor, and you're fine with whatever therapy, you're good. But I just want to challenge you. If there are things that you can do that we talked about with the obesity, the lifestyle, those things, you can't change the age. If there are things you can do with your stress, if there are things that you can do with your diet, let's try to incorporate some of those things so that you can manage those conditions better, hopefully look for the root issue that may be there. And then from there, maybe you can actually talk to your doctor, your healthcare professional about, okay, how do we get out of this? I want to do things a little bit more naturally. Is there an option for me? You don't want to quit your medicine just cold turkey. You don't want to do that. Basically, what you want to do is talk to your healthcare professional. You guys come up with a plan together. You need to be armed with information when you go in, because most of them are going to be there. The way we learned is this is how we treat reflux. I'm not an expert. I'm not claiming to be an expert, but I'm just giving you some information, okay? So what do? What I would do, okay? I would get rid of food allergies. Common food allergies are gonna be dairy, gluten. I would get rid of those things that might be contributing to that. I would fix my diet as much as possible. If I know that spicy foods are giving me an issue, or gluten, I'm gonna stay off of those things. Doesn't mean you gotta stay off of them forever. Remember, we're just trying to fix the gut. We're trying to heal the gut a little bit, okay? If we heal that gut a little bit, maybe we won't have these issues going on long term. So that's the goal, to try and fix the gut a little bit, okay? So you want to avoid overeating. A lot of us overeat. And, you know, this is a Sunday where I am here in Maryland. And, you know, normally we have these big Sunday dinners. You know, we eat a little bit more on Sundays, and then we kind of lay down, and, you know, that can increase that abdominal pressure because, you know, you're eating too much, and then you're laying down, taking a nap after you're eating. And so that can contribute. So you want to remove those triggers like alcohol, caffeine, nicotine. You want to remove those. Lifestyle wise, if you need to talk to somebody about your stressors, there are things that we can do. I know this year has presented a lot of challenges for a lot of people, myself included, you know, and but there is hope out there for us as we navigate this season. Okay, so I want to leave you with that. But the stress, if you don't manage it well, can affect the nerves within the gut lining. Okay. And because loss of magnesium also there because of the PPIs that's needed to relax this, there's just so much going on to manage that stress. That's a whole nother subject we're going to do a talk about. So just put a pin in that for right there, okay? So as I said, don't quit your meds cold turkey. Talk to your doctor, or talk to a health coach who might can help you identify some of the things that you're dealing with, who might give you help you to get some tweaks and techniques on how to manage your diet. Whether how long do you need to avoid dairy? Do you need to avoid fiber? Do you need to go low carb? Do I need to add digestive enzymes in? You probably do. You definitely need to increase your stomach acid, right? So you can do that by adding things in like bitters, bitter vegetables, bitter herbs, dandelions, fennel, ginger, milk thistle. Those are bitters. And then there's an herbal formulation called bitters. You can also purchase digestive enzymes that are specific to break down protein and fats and carbs. You might want to consider going on a low carb diet, as I said. I'm one of those people that if you ever go out to lunch and dinner with me, I rarely drink. Like, I may order a lemonade or what normally is just the water I'm getting, but I rarely drink water with my meals. Why is that? Well, first of all, I want to be able to enjoy all of my food. And if I'm drinking, I get full too fast. But the second reason is, you know, when you're drinking, it dilutes your enzymes. And if your enzymes are already low, your stomach acid's already low, and you're drinking fluids, it's going to dilute them even more. Okay? And you're not going to get the proper digestion. So if you do need to drink something, just take a few sips of water while you're drinking to kind of stimulate that. You can actually put some lemon in it or lime. That will help to stimulate those juices too as well in there while you're drinking. But just sips, don't just go down, okay? You want to talk to somebody about dressing to see if you have any of those things that we talked about. You know, maybe you have like leaky gut or, you know, food sensitivities or H. pylori. Some of those things may be contributing to your overall problem. But you don't know it because you're just taking the medication and, you know, it's not getting better and you've been taking it for months, or maybe you've been taking it for years. As I know in some people that I've talked to, they've been taking it for years. Their doctor never took them off of it. And the studies say that they're not supposed to be on there that long, okay? So maybe you need to lose some weight, especially with the belly fat, go around there. Maybe the gut lining overall, you know, we're talking about leaky gut. So you can add things in like healing broths and stuff like that, like bone broth into the diet. Your mom always told you, at least I think so. If not, I'm telling you, chew your food. Digestion starts when you start to look at the food, think about the food, smell the food. You start to get all these juices flowing. When they get in your mouth, you need to chew it, really begin to chew it, especially if you're having a problem with digestion. You want to make sure that you get optimum chews in your mouth so that when you do swallow and go down, you have less, the food is a little bit more broken down, that when it gets into the stomach, it can actually go through the process a little bit easier, okay? So heal your gut. There are things we talk about, decreasing your fiber. You may, like I said, you know, sometimes the fibers can be an issue for you because it can actually trap some of the nutrients that you need in and pull it out if it just kind of goes through straight through. So make sure that that's something you're doing. There are things, herbs and stuff that you can research and look for, but you want to start first with the food. Start first with the things that you can do like right now. And we talked about, you can't change your age, you know, but there are other things you can change. And if you want to feel better, then you will take some of this information and make sure that you're not having those underlying things where, you know, you've got food sensitivities and leaky gut and H. pylori and gastritis, all of those things going on in the gut. And you're just still taking the PPIs without addressing those things that may be there and hidden. So talk to your doctor, your health coach, and see what answers you can get. I can be reached here on my YouTube channel, Food Girl 29. I'm also known as Shirley Banks. On Facebook and on Instagram at Food Girl 29. There are a couple of herbs and things that you can add in, but you want to try to heal the gut first. And one of the things that, you know, take the offending things out. You know, I was telling them about a story like my tire, my rear tire on my right side of my car. The light keeps saying that it needs air in it. So I put air in it and the light went out and I drove around for a while and then the light came back on, put air in it, that it has a leak. So I went and put more air in it. Then my son put air in it. And, you know, this past week, the light came on again. So is it that I just need to put air in it or I need to have somebody look at that tire? Because what it's telling me is that what I'm doing, that temporary thing that I'm doing, putting the air in there, is not fixing the problem. It's telling me over and over that there's a problem with this tire and you need to do something about it before I'm on the beltway and the tire blow out or something like that. You know, that won't happen, but I'm just saying. So is that what your body, is there a light on in your body telling you that something is wrong, that you need to get fixed? But you just keep putting air in it. You just keep taking a medication. You just keep, you know, glossing over it, thinking it's going to get better. Let's do something different. Okay? Let's do something different. Health and healing. Let's see. Start recording.